Okay, let's all stand for the Pledge of Allegiance. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. Mr. Pratt, can you certify the agenda?
Yes, Mr. President. Chris Pratt with the County Attorney's Office. All of the items on today's agenda have been reviewed by the County Attorney's Office and meet legal approval.
Thank you. I have no disclosures for this meeting. Do any of my colleagues?
I have none, thank you.
I have none.
No, sir. Okay. Thank you all. Has everybody had the opportunity to review the meeting minutes?
I have.
I have.
Are there any revisions to those meeting minutes?
I have none.
I have none.
None.
Fantastic. Then I would like to seek a motion to approve the meeting minutes.
I have a motion to approve item A of the consent agenda.
Thank you.
I second.
All in favor, say aye.
Aye.
Opposed? Great. We'll now move on to our regular agenda. Director Hill, I will turn the mic over to you.
Okay, thank you. So I left my glasses in my truck, so if I don't know what I'm reading, we'll just...
Would you like to borrow a pair?
No, my prescription's a little wacky, it's not going to work. So basically, the report says that we're now fully operational. We're missing about 6 employees that we haven't quite hired yet, but we're still doing all the functions. We had a little bit of a hiccup when we started with Stride for the clinical services in that their staff weren't all up to speed, and the Douglas County people were calling what that was about, but we've gotten that fixed, and we have a dedicated number now where people from Douglas County are directed to call, and it forwards to someone at Stride who knows what's going on. So people are getting in to get services. Not that a lot of people have been flocking there, but they are being successful, because when they weren't successful, they let us know, so we knew about it. Activities I presented to the State Board of Health on our new health department and how it's constructed. Got not too many questions. A couple of people were concerned that we weren't doing clinical services in-house, but I told them that we had thought this through and it should work out, and they were satisfied with that.
Can I stop you?
You can.
What were the nature of the, expressed concerns, but what were the nature of the concerns they raised?
So it was a physician member of the Board of Health who was concerned that health departments had to provide clinical services in-house, which, across the nation is not always the case. So I was able to talk him through that, and the gentleman from Mesa County said, yeah, he's right on, this is the way public health departments should be, so I might be moving to Mesa County when I retire from here, because I like that guy. I worked with HR to develop a pay plan that's specific to public health, so there are people who have public health titles and they're not grouped in with mechanics and whatnot. We did all the reviews of our employees and calculated out salary increases for them. I got editor access to the web pages, so now when I see something that I think is a typo, I just jump on it and fix it instead of having to yammer to somebody to fix it for me. I did several media interviews, newspaper, TV, and whatever. I presented last week at a countywide leadership training program. We've had our inaugural meeting of our Quality Improvement Committee to start launching our continuous quality improvement efforts, which will be part of our accreditation coming in the future. And I'm not going to go too deep into the respiratory disease stuff that I had inserted in here before asking the epidemiologist to do their report that's coming later in the agenda. But it's not looking too bad for us, I think, right now. We'll see if Rachel and Elijah say something different when they get up to speak. Future plans, I'm working more with the Colorado Association of Local Health Officials. I'm on their legislative committee and policy committee, reviewing legislative proposals from the state to kind of help and make sure that local public health departments are not left out in the cold. I've also been working more with the Metropolitan Denver Partnership for Health And for my troubles, I've been appointed as the chair of that organization, so sometimes it doesn't pay to be helpful, but it's in my nature. Other than that, we're going to be starting a strategic planning process. I've got a proposal from a consultant, and I'll be looking for or asking for one of you to be a part of that process, because when we get to accreditation, one of their questions is, how was your Board of Health involved in your strategic planning process? And the easy answer is to have one of the board members. We'll certainly bring it to you to ratify, hopefully in May at your May meeting. But we would like one of you to participate, and more than one if you would like to participate in the meetings around that process. Any questions?
It's not a question, it's just a comment. When I read this, I was really thrilled to see that you are getting involved in the metro area and other public health statewide or local organizations, bringing your expertise, so thank you for doing that.
You are welcome. That's my report. I get to do a presentation later because Caitlin's not here. So.
Okay. Are there any other questions from board members?
None here.
Okay. And the remainder of the reports are, and maybe I can just ask you this. So on WIC, I saw in the reports that we're starting to take on WIC. Are we doing Elbert County as well? We had talked about that at one time. So we're doing both Douglas and Elbert.
Correct. We are doing Elbert County twice a month. Laura, is that correct? One time a month we're going there, but they are also welcome to come to our locations, which is what they did under Tri-County. They came here to Castle Rock, I believe.
Right, right. Okay. And I'm just kind of curious on water and wastewater permitting, what type of activity we're seeing. It's sort of, I'm interested actually because it's a proxy for growth in the county, and I'm wondering what.
It is, and in Caitlin's report, she did mention some numbers. Anybody from
Yeah, I
Environmental Health
apologize, I
that
looked at
wants
that.
to speak to that question?
Or I can follow up later. I'm just curious about the just how busy y'all are, again, as a proxy for what sort of is happening with growth in the county. But I can follow up with you guys later, so it's not important.
There are a fair number, and I think in the written report, she does list
Okay.
some numbers of inspections.
I looked at it, okay. Yeah, I'm relative, I mean, so it's a relative number to what's been done in the
It's
past.
not slowed down even, one would expect a winter slowdown as the
Yeah.
ground gets kind of hard to dig in. But I think the last I talked to Caitlin about it, they hadn't really seen as much of an expected slowdown. So things seem to be still charging ahead from what I can tell.
So the sort of, what I'd say is growth in the county isn't slowing down.
Certainly the building of houses is not slowing down. Whether people are buying and occupying them, I'm not sure, but
Spoken like a speculator, Michael. That's all the questions I had. Anybody else? We do have a presentation, I think that I requested, a sort of an update on what's happening with the respective, respiratory diseases that we're seeing across the country and what's happening in Douglas County.
Elijah and Rachel, two of our crack epidemiology team, are going to present to you.
All right. Hello, Board of Health members. It's good to see you again. My name is Rachel. I'm happy to introduce you to my colleague Elijah. We are both epidemiologists over at the Douglas County Health Department. Let's see.
All right, so I'll start with a quick summary here. Our influenza season and respiratory season began officially October 2nd of 2022 and will continue through May 20th of this year. Since then, we have handled 45 school and child care outbreaks since early October. We've also supported outbreak mitigation in 11 long-term care facilities since mid-October. Overall, COVID-19 has plateaued. RSV has been trending downward since November, and influenza rates are still rising just a little bit. Influenza A, H3N2 is the predominant subtype circulating currently, according to our state health department. 136,000 flu vaccine doses have been administered since August 2022, and 38% of the population 6 months and older has received a flu vaccine. 114 total hospitalizations have occurred since October 2022. 61% of those alone have been in December. In childcares and schools, we've handled 17 influenza outbreaks since October.
So, actually, let's go back. Yeah, perfect. So the graph on the left, we talked about last time I presented. It's the communicable disease report, which is live on our website. I update these numbers once a month. What you see here is influenza and RSV hospitalizations only in the county. So these numbers are gathered on the first of every month and published to our website. The line in green, for those who are having trouble seeing it, is RSV hospitalizations, and the line in blue, marked by X's, is influenza hospitalizations. So as you can see, we've had a steady increase of influenza while RSV peaked and then is dropping, but I'm curious to see what our numbers are like for January. So the CDPHE recently released flu immunization data to our LPHA data portal. So what you see here, these two graphs side by side represent the same data. It's just two different views of the same thing. Our current flu season is highlighted in blue, and then the past two seasons are highlighted in light and dark gray. So as you can tell, we are coming in a bit short as far as flu immunizations in the county this season, just under the past 2 years. And then this view is percent immunized by age group. So again, the blue represents Douglas County, while the gray represents the percent immunized in Colorado. So we are still above the state immunization rate for each age category. So lots of representation in the 65 and older population, which is great to see.
All right, so jumping back to respiratory syncytial virus, lovingly known as RSV. Hospitalizations have been declining since late November, which we're glad to see. In total, there were 278 since October of 2022. 28% of these occurred in December. We've been seeing an 8.8% positivity rate. That comes from the state health department. And pediatric cases have made up the majority of our RSV cases since the beginning of October, anywhere from about 67 to 97%, which fluctuates by proportion over time.
May I ask you a question real fast? And this, I apologize, this is probably remedial. Is RSV seasonal?
It is.
Okay, so we would expect, it looked like cases were going up. That way, what's the is it like, does it run with flu season? Or-
Typically it does, yes. And what we're seeing is that things have kind of shifted a little bit since the pandemic. But typically, yes, there is a seasonality.
So the chart you're showing sort of an anomaly, because it's growing, well, no, wait a minute, it's, RSV is going down and then flu is going up.
Yes, I can speak to that. So we had a very early peak in RSV that is
Okay.
considered an anomaly from previous respiratory seasons. Again, it will be interesting to see what our January hospitalizations come out to be. The state has a flu and RSV report published to their site that is very in-depth as far as all flu and RSV data goes. And I would say that, so because their data represents flu and RSV or at least RSV in the 5-county metro area, their trends are consistent with what we see here in Douglas County.
One last question, so RSV, I believe the concern with RSV is that it hits kids, right? And so could the downward trend here be consistent with schools being let out for winter break? And can we, possible that it's going to be with flu again and start jumping back up?
That is Possible, yes. That was my concern, is that the drop that we saw was due to the holidays, kids staying home.
No, it's just.
But I am not sure what else we could attribute to that to.
Well, and I would say seasonally too, and in the past, what we've typically seen RSV do is rise pretty drastically and then have a sharp drop off too. So we're encouraged that we have some herd immunity at this point.
Okay. So, okay, I see your point. So you'll continue to no doubt track this closely, but what you're hoping is that, not hoping, but your experience is that that's the peak that we're seeing there. This is the decline, and we're not going to see a second peak. We typically wouldn't see a second peak.
That's right.
Okay. Sorry to interrupt you. Thank you.
May I interrupt?
Oh, yes, please.
Please. I do have a question when you talk about hospitalizations. So are those hospitalizations in Douglas County, or are those hospitalizations of Douglas County residents in other hospitals in the metro area?
These would be hospitalizations. Typically, our residents can seek care anywhere, of course. So when this happens, we see that they are hospitalized. However, they could be in any hospital in the Denver metro area.
Thank you. Just clarifying, that is Douglas County residents that the numbers are talking about.
That's right.
Thank you. I know death certificates are confusing and different, so that's why I just wanted to clarify that.
Of course. So in child cares in schools, our EPI team has handled 28 RSV outbreaks specifically since October.
Awesome. So as we mentioned earlier, COVID-19 numbers have plateaued fairly since October. The bar chart you see at the bottom here is a snapshot of October 1st through today. So as you can see, it's been pretty steady. In the past 30 days, though, we have had approximately 946 positive cases, 48 hospitalizations, and 1 COVID death. So.
I believe that's what we have for you.
And the total numbers are the total since the pandemic began?
So what you see here is a snapshot of just since October 1st. So this is,
okay, thank
so the
you.
totals, the box
Thank
on
you.
the bottom below last 30 days, that's just from October 1st through today.
My apologies, I didn't see the date range. Thank you.
No, no problem.
That was really helpful.
Could I please ask a question? I'd like to know what the age range of those positive cases and what age group the death was in.
For the COVID data?
Yes.
I don't have it in front of me at this moment. I'm happy to look that up.
I would appreciate that, because I think it's important to know what parts of our community are most hit by this, and that's where we should direct our efforts with COVID.
Absolutely. So what you see here is just a screen grab of the COVID dashboard. As you can see on the tabs on the left, you could go to hospitalizations and deaths, and that is separated out by age group as well on the dashboard.
Are there other questions?
No.
No other, okay. One last one for me then. What have these hospitalization numbers taken cumulatively for all three? What has this meant to the hospitals? What's their capacity? How stretched have they been? Just sort of, how the hospital's been doing?
I might call on our fellow APR manager to speak into that question.
I didn't want John Surbeck to put on a tie for nothing.
Good evening. Would you ask your question again, please?
With the combined RSV, flu, and COVID hospitalizations, what has that meant for hospitals in terms of capacity?
They've been really stretched at times, but I think one of the pieces that's come out of the whole COVID experience is they have really refined their whole surge capacity, and they manage extremely well. They have been, in December, they were very challenged, and there was long wait times in the ER and so forth. But, and the underlying kind of constraint has been and probably will continue to be for an extended period of time staffing. But they've managed quite well. They've moved their procedures and protocol to be more efficient and more effective with what they have to work with, and they've just done an incredible job. We stay in touch with them and look for opportunities to assist them, and I just can't give them enough accolades for how they've handled and they've managed the capacity effectively.
So if they were to have a real problem, they would contact you, correct?
Sure. Yeah, there's a number of assets that they would seek assistance from, and we're certainly one of them.
Right.
One thing that I find interesting in this, if I may, is that most hospitals have far more than 48 beds. And 48 hospitalizations, you would think, within a month, should not strain the capacity of our hospital system. But it would be very interesting to know what their actual respiratory admission hospital capacity is, so that we know when we're getting close to something that could be a problem. It's better to do this proactively than to be surprised.
And again, we're very fortunate to be in the area that we are, where the connectivity between the various systems is functional at a very high level. In December, they were transferring patients based on specific needs that could be facilitated at one facility that was reaching capacity at another. So there's an incredible amount of conversation that goes on a daily basis to manage case flow.
Yeah, I appreciate that. And I know also we have several large integrated systems such as Centura, so that probably does make it a little easier. Thank you very much.
Yes, ma'am.
Thank you, Mr. Surbeck. Are there any other questions from board members? Anything? No? Dr. Hill, anything you want to add on?
No, I think one thing, John's team did put a lot of work in on this, and then the pinch came with the RSV with the very young children and the PICU and NICU and all those other U functions being stressed, because those are not very big units in most of the hospitals. So that's where there was a lot of shuffling around the metro area and even threats of sending people out of state, but the other states were having the same problem. So there really was a crunch, and our staff did participate in a lot of meetings, and not that we really had a lot to bring to the table, but we were there to help if we could.
Okay, that makes a lot of sense then, because the Children's Hospital system is expanding, of course, and I've seen, some of their facilities. But children are a very specialized group, and generally they don't get hospitalized very often. And so, yeah, that makes a lot more sense than, that's why I was asking about the age ranges that are affected in this, because it makes a lot more difference. We have a lot more adult beds that we can convert, and convert very quickly. Children's care, that's a different matter. So thank you very much for clarifying that.
Thank you. Yeah, and thanks for the update as well. Oh, thanks for the update as well. This is obviously gathering a lot of attention across the country and across the state, and I think it's important that we maintain a level of awareness of what's happening in the county, because in the event that the hospitals do run into problems, we would have some role to play to try and assist them alleviate that problem, and we'd certainly have to be communicating with our public about what's happening and what we're doing, what the hospitals are doing in order to try to address it. So I think on all matters such as this, that we just need to keep a high level of awareness with respect to what's happening, so that, one, we are aware of the problems arising, and two, quite frankly, and particularly for the commissioners who are out in public perhaps more than the rest of us, you're in a position to answer questions about what's happening and where we're postured in the event that there is a larger problem. So on all the issues such as that, I think it's important that the board and particularly the commissioners be kept up to speed so they can be fully informed and aware. The next, we have 2 action items coming up, and Director Hill, I will turn them to you to give a proposal, and then we'll take public comment, and then we will take action. Director Hill?
All right, thank you. So at the last meeting, we had some casual discussions about changing the meeting frequency. So I took that upon myself to come up with a proposal that we go to a bi-monthly or every other month meeting schedule. Because there are times now that the department is fully operational that I don't have a lot of actual business or action items for you. So we can certainly come together and we'll come and do reports and presentations to you if that's what you'd like. But I value your time, so if you'd rather not come here just for presentations and come for business, then I'm proposing that we go to a every other month meeting schedule. Same day of the month, same time, same place, just skip the even-numbered months.
So let me just add that I really like that idea because I think one of the founding principles that we came together when we created this health department, excuse me, is that we were going to do what we needed to do and what the community needed, but we were not going to be bureaucratic. So thank you for looking at that and making this decision. I think it's a good one, Mr. Hill.
Other comments?
Yeah, I'll echo the comments of my colleague Commissioner, because we had talked about when we really came together as a board when the board was formed, that we did feel that during the formulation time there was going to be a need for that full court press, that monthly meeting schedule. I believe we even discussed meeting more than once a month in one of those very first meetings. Well, very much like my colleague has said, very much like the executive director has said, that formulation has occurred. So I totally support having the discussion of going to meeting once every 2 months. On the other hand, quarterly, I guess the only thing, actually, I'm kind of inclined to go quarterly. The only thing that would increase that frequency would be if we were seeing a more serious situation like the epidemiologists briefed us on in terms of flu, RSV. Well, we kind of already know that's usually defined by season. So perhaps that's something that we could take up as a topic of discussion as we're coming into August, September, October months. But in the meantime, in terms of our decisions right now, I think it'd be wholly appropriate for us to consider quarterly meetings or at the most every other month.
Yeah, and you are required by the state to meet at least quarterly. So I was trying to split the difference here, but it's certainly up to your board on how often you would like to meet.
Oh, yes, Dr. Ms. Milano.
I also support the, every other month process, only because of the seasonality of some of these things. Like RSV, for instance, typically peaks in the spring. So quarterly, we could miss some of the discussion if we needed to make any kind of action items around that in a quarterly basis. I mean, we could change if that changes in the future as far as the number of meetings and what may be coming up. But currently, I think every other month, I totally support that. We also said that we would be efficient with our time and talent, so I support the every other month proposal.
Okay, I support the every other month proposal as well, because I think it would be a little too soon to be totally hands-off on this, since we really haven't been a functional health board for that long. So every other month, and then reassess it next year and see what dates and how the patterns of disease and reporting goes would be very adequate.
Can I make a suggestion? Maybe split the difference. So we stick to every other month for now, but reassess in May because, to your point, So if RSV is going to, if there's going to be a second peak of RSV, if it's going to happen in the spring, we would then have a March meeting and then a May meeting. And then it may be worthwhile to say, next meeting will be after the summer. And then we go to quarterly, and then we can assess going into 2024 whether or not we want to have every other month meetings or quarterly meetings, just sort of play it by, sort of reassess it at that point. So I don't know, Commissioner, if that is consistent or if that's to split the difference that would work for you, but we have every other month up until May, and then we reassess in May, and perhaps from May, we don't have another meeting until, October. And then we can decide at that meeting if we want to go to quarterly or every other month. And I'd rely upon the advice of Director Hill and his team about what's the best way to handle it after that.
Well, and certainly whatever you do, if something major comes up, I'm going to ask you to come together for a special meeting. So it's not like you can't meet in between if something happens.
Yeah, actually, that's one of the things that kind of struck me is that if we do have, an increase in concern, we will rely upon the executive director to call us back together, but don't our bylaws also allow members of the board to call in the president of the board to call a special meeting? So actually, my discussion point about quarterly, I think the reasoning of the other members of the board is sound. I mean, let's go ahead and stick to the every other month. Maybe we do have the discussion in May about altering again, but I think the comments that have been made for a meeting every other month are sound. I'd be okay with it. We get paid the same, don't we?
Right. Yes, I think that's right. And so does Michael. Okay, so let's do this then. Let's is there any public comment on this proposal? Yes, ma'am. If you would just give us your name and the town you live in, I would appreciate it.
One of the things that I would like for you guys to consider is that the Board of Health isn't just about the epidemiology, and that there can be other emergent issues in the other areas that the new county department is covering. You could have a gigantic hazmat issue. You could have a problem with an outbreak in the environmental side where you have a slew of potentially restaurants that are having a problem. So I would caution going to quarterly too quickly. I think that over the course of a year, once the board and the department gains its stride, I've read the individual reports, and I can see that there's a lot going on in each of the separate sections. And I would say give them a chance to hit their stride and get caught up on the work that they're doing. And I would also say that you don't want to be blindsided. You don't want to be scrambling for a meeting. I know you can call a meeting at any time, but look at the diversity of your group. It may not be as easy as you would like. So my advice would be to do the every other month and see how it goes for a year. And then after that, you can reassess. Thanks.
Thank you. Any other comment in the room? Is there any public comment online?
Thank you, Mr. President. I have no online comment.
Okay. Well, with that, then, I would seek a motion to move, move our meetings to every other month in a second.
If it pleases the board, I do have a motion to direct the executive director to schedule Board of Health meetings to an every other month schedule, beginning with the next meeting being March of this year, and proceed with that schedule until further direction.
Thank you. Second?
I'll second that.
We have a motion, we have a second. Any further discussion?
I support the every other month, and I think that Fran, Fran Santagata brought in some really good information, that we are a very new health department. People are watching us, and I think to continue every other month would be a good look for this county.
Excellent point. All in favor?
Aye.
Aye.
Aye. Opposed? Excellent. So we'll move on to the next item. Review and consider staff request to aid recreational motor services. Director Hill.
So last year, when we were discussing what services this department would provide, we kind of skipped over the recreational water or pool and spa issue because we weren't sure. It was kind of like, yeah, maybe let's look at it later. So now it's later, we've looked at it. We've determined that it really would not have any net cost to the county or to the department's budget because the permit fees will pay what it costs us to operate the program. So we're proposing that we enact a recreational water program starting with, well, let me do the presentation because Caitlin's got the information on the wins in here.
If you want to pivot, you can go right back.
They help control the slides.
All right, so I've done a lot of talking at these meetings, but this is my first presentation, so let's see how it goes. All right, so this tells you what it is. It's inspections of public pools, hot tubs, and splash pads. Make sure the filters work, make sure they're maintaining the chemical levels right to not have bacteria in the water and viruses. Make sure they're storing their chemicals safely and help the community have a clean, safe, healthy place to recreate. So why should we have this? It aligns with our priority of disease management and prevention. We've had cryptosporidium here in the county before, so it is something we know is an issue. We've actually had people asking about this program. We've had operators wondering when they're going to get inspected, so it seems not to be something they're afraid of, but they kind of want to have the validation, I believe. And we've had outbreaks in the past, and statutorily, we are authorized to provide these services. So there are 71 pools with 135 filtration systems in the county. Inspections take about an hour per facility, so we expect about 350 hours of staff time. So we won't need to add additional staff. This will be kind of a fill-in-the-gap program. So if you're out doing a restaurant or grocery store inspection or a septic tank inspection and you have an extra hour in your day, you would run out and do one of these, and over the course of the year, we would get them all done.
Pardon, can you go back again? I just have a quick question. So there are 71 pools, 135 filtration systems. It takes an hour to do one, but there's 350 hours of staff time. I'm looking at the math.
So I believe what's going on there, in case Caitlin's on vacation, who made this up. So aside from inspecting the filtration systems, we go by and do a chemical check once in a while, and I think
Okay.
that's where the extra hours are.
Okay, I'm just curious.
Well, and,
Good question.
and then, of course, always thinking back to my times in the Army and conducting inspections, there's always the paperwork afterwards.
Good point.
Well, and this also is trying to cover like complaints. If somebody complains, hey, I got sick from XYZ pool or spa, that we'd have to go out. So I believe that's what she's got in here is extra time for those kinds of inspections.
Okay, fair enough.
Are these public pools and spas or private or both?
These are public, like hotels, and so it's private property, but it's still open to the public. We're not going in people's backyards to their pools, which
Thank you.
there don't appear to be a lot of here. So here's Caitlin's math on the program. She comes up with a revenue of $21,600 and expenditures of $21,600. So a net nothing to us. So the plan is to inspect twice a year. One is the full inspection that takes a while, and the other one is just a quick chemical check. Respond to complaints, follow the state regulations. So we would send out bills for these permits in March, asking for payment in April, and then in May, we would start doing the inspections. And then we get to the question slide, so fire them at me and I'll see if I've got the answers.
So, Mr. Hill, do you know if Tri-County Health was doing these inspections in Douglas County?
They were, I'm not sure at what pace during the pandemic. A lot of things kind of slipped during the pandemic, but they were doing these, yes. That's part of why people have asked us, hey, where's my inspection, is because they're used to getting inspected.
Good, thank you for that information.
And you may have answered the question. I think you touched upon the question. Your slide indicated that people have sort of been asking for this service to be provided. That pool owner, or the facility management that run pools, who's the cohort that's asking?
It's been the operators who have noticed that no one's come around to inspect them, and they're wondering what's going on, yes.
Okay. Is there, and there's a benefit to them, obviously, because they get inspected, they can ensure they're doing things correctly, I presume.
Right, and I mean, that's our goal with all our inspection programs, is to help make sure people are doing things safely.
Okay.
Yeah, just to add a little color to, perhaps a little history, if we remind ourselves back to the days of June 2020, the town of Castle Rock actually had a hosted debate in terms of considering departing from Tri-County and setting up a municipal health department. And this was actually a bit of a hot topic almost immediately, that I still find it a little humorous that it dominated a degree of a portion of that meeting, because a lot of the pools had gone through the process of, do we open during that time period, during the COVID lockdowns, in time for Memorial Day? I believe in almost every instance the answer was no, but then they were probably very similar to what the executive director described. Well, who's going to inspect us when it is time to do it? So it is, again, it was a discussion we did have when talking about services this past year before we stood up the department. And yeah, I mean, I think this is sort of a hot topic for the pool operators.
Okay. Any other questions for Director Hill? Okay. Is there any public comment in the room? Yes, ma'am.
Hello again, Fran Santagata, Roxborough. I think this is a critical program. Having run an aquatic program in my exercise physiology days for Spalding Hospital, it was a check and balance on our pool operators who were certified. However, we were very concerned that with our patient population, and you can look at the same thing with children who may or may not be continent, that you have to have those chemicals in balance, and you have to have the filtration system working properly, and the antiseptic part of that working properly because of the liability. Now, back then, I remember it was a law. We could not open until we were inspected and approved, and we were on a regular schedule, and if we didn't meet that, they'd shut us down. And it was Tri-County because it was in Englewood. So I don't know what the laws are now. I've been out of that field for quite a while, but I would be very surprised if there isn't a requirement to do that for public pools today because of how critical it is and how quickly you could have an outbreak. Back in the 90s, there was a crypto outbreak at Westminster Recreation Center. I don't know if you guys remember that. It shut the pool down. They did not know what was going on. It took them months to figure it out. And then there was a problem with the filtration system as well as the disinfection system. A lot of people got sick with that. So I really think this is a critical, very positive program. And I applaud you for taking the proactive stance to include it in the health department. It's a great thing for the community. Thank you.
Thank you. Is there any other public comment? Yes. If you just provide your name and city you live in. Thank you.
I'm Catherine. I'm with Castle Rock. I wasn't going to mention it because I don't want to add to anyone else's plate, but I remember during COVID I was on an HOA board of directors, and determining whether to open or close a pool was a really big topic. And I remember picking up the phone saying, I'm going to call the health department, I'm going to call Tri-County. Okay, so there's these rules of cleaning every hour on the hour. However, we only have a $200,000 budget for the year. Do we need to hire someone? Can we, as homeowners, clean every hour on the hour, as one of the challenges that we were told that we had to face? And then being educated about the communicable diseases and our insurance and how we had to consult our attorneys. And so I don't know if we needed to add, inspections for HOAs for their private pools, but there's an opportunity there to provide education, let them know what's going on if something were to happen again. And I just remember feeling kind of lost, and Tri-County said that wasn't under their purview because it was private, so I just wanted to share that and look out for the other citizens and volunteers trying to open up swimming pools. So, thank you.
Thank you. Any other comment? Is there any comment online?
Thank you, Mr. President. I have no online comment.
Okay. So I'll seek a motion to Ms. Billy's point. That's something we'll talk to Director Hill about an educational service, not a regulatory one. Obviously, if they're not regulated, they're not regulated. But perhaps there's some educational outreach that could happen with HOAs, giving them some guidance on best practices. Anyway, we will leave that in your plate.
Yeah, because that's one of the, obviously, I'm reminding myself of the conversation we had here in the town of you have HOAs that are not necessarily, that are corporate managed. You have other, swimming pools that have some degree of corporate management. I think of the hotels who are owned by corporate entities, or at least they are following a corporate brand, even if they are owned by individual owners and operators for that one facility. They probably need to have a clean bill of health certificate to report back to a corporate entity at some point in time. So perhaps, some kind of consideration for private pools that do need to have some kind of inspection to show to a corporate entity. Maybe we can work that in as well. And of course, if this is a service people are willing to pay for, perhaps there's a degree of public service that goes along with it that we might want to consider.
Sure, Commissioner, and the hotels are serving the public, so that's why they're part of our purview already, where the HOAs are private to the residents. So I would have to look at the state laws and see how far we can go, but certainly happy to help in an educational basis in the meanwhile. If people want advice, I'm sure we can give it. We're going to get some of our people trained as certified pool operators, so they'll know everything there is to know about running a pool, and our job is to be helpful.
Excellent. Any other discussion? I would seek a motion I would seek a motion to adopt adding recreational water services.
So moved.
I'll second that.
We have a motion and second. All in favor, say aye.
Aye.
Aye. Opposed? Great. So the next item, the next item on our list is executive session. Mr. Pratt, I believe there's some verbiage you need to provide for us to go into executive session.
Correct. And to be specific, this is a chance for the annual review of the executive director's performance. This is mandated by the contract of the executive director. It is typically performed before December 21st of each year. This year we did not get that accomplished, and so we're just catching up. Executive session is at your discretion. If you wish to go into executive session, we can, with a majority vote, go into executive session. We're prepared to do so. That would be under 24-6-4024, get the reference correct here, F, to discuss a personnel matter. And this is so that an employee's affairs can be kept, their privacy can be respected. It's common in the course of conducting business for local governments to go into executive session for this purpose.
Yes, because we are discussing personnel matters. In fact, we will be going into executive session. I think it's appropriate that we do so. So I need a motion and a second to go into executive session. So I will move that we go into executive session, and I will seek a second.
Second.
Thank you. All in favor, say aye. 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 Opposed? Great. Well, I anticipate for those that are going to be remaining in the room, if any of you, that we will be down in about a half an hour. Thank you.
I'll put these together for a moment.
Thank you. Thank you.
You're not on yet, brother.
Oh, thank you. Are we live? We are.
Yes, sir, we are recording.
Thank you. First, I want to thank everybody for participation in executive session. We did go into executive session to discuss you, Director Hill, and discuss your personnel issues. You're coming up on a year, and we wanted to discuss privately the work that you're doing, and I think I'm comfortable saying publicly that everybody's very happy with the work that has been done. Your big job was to get a health department up and running by December 31st, and we were up and running before that. So we're happy with that, and we are happy with the services that you've been providing to the county, and we're happy that our judgment was right in hiring you because you did a great job. So with that, we were discussing your compensation package, and I will turn it over to Commissioner Teal, and I'll turn it over to any of my colleagues who want to make any comments about your Director Hill's performance, and then I'll turn it over to Commissioner Teal, who will have a motion to make.
So, Mike, I'd like to say that your demeanor is just perfect for this job. And lately, we've seen a lot of articles in the paper comparing the three new departments that came out of Tri-County's departure. And you have a really nice way of interacting with the media, and I really think that you have just hit the mark of what we asked of you a year ago when you applied for the job. And I always remember that you had a whole layout, a structure of what your department was going to look like, and you were ready to go when you interviewed with us. And I was so impressed. I have hired many, many people over my years. And I think you were probably the most prepared who came in, ready to go, hit the ground, and you have not, it wasn't a bait and switch. What you offered is what you've delivered, and I just want you to know how really pleased I am. So thank you.
Actually, I will second that. I've been very pleased with your competence and skill, and that is somewhat difficult in these times to find people that actually do what they say they're going to do. And we have an excellent health department here, and we're started on a proper course, and that's due to your leadership. Thank you.
Kim, would you like to make any comments before I make the motion?
I think the only comment that I'd like to make is that you've really exceeded in my eyes of what I had expected in a difficult kind of climate in order to do this. So I really appreciate not only your ability to articulate for the public, but to represent the people of Douglas County. So I just appreciate all the things that you've done.
Well, so first is a declaratory statement to the public who may be observing. Obviously, I'm sure you can tell it was a very nice discussion that was had in executive session. No decision was made. However, I invite my fellow board members to correct me if I'm wrong on this. I believe we did come to a consensus on direction that we would like to give with this vote. So, Mike, it was on my part, I've been very impressed. I've been, I think I've got on record how impressed I've been with your performance. I ask you to keep it up. We are still very much counting on you. But if it pleases the board, I do have a motion to direct HR staff to implement the the alterations to the compensation of the executive director of the health department per the discussion had, and take under the direction the additional considerations for future performance pay and compensation. And I ask for a second.
Okay, I will second that motion.
And now, before we take a vote, I'd like to ask if there's any public comment from the attendees in the room. And are there any comments online?
No, sir, I have no online comment.
Okay. With that, then, we have a motion, we have a second on directions to HR with respect to the compensation package for Director Hill. All in favor of moving that forward, say aye.
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 Aye. Opposed? Excellent. It is proposed and approved. Next, are there any general citizen comments from the audience? Do we have any comments online?
No, sir, no online comments.
Okay. Well, with that, I would accept a motion to, and a second to adjourn.
So moved.
Second.
I have a motion, second. All in favor of adjourning, say aye.
Aye.
Aye. All opposed? Thank you. I'll see you all in March. Thank you.
Cool.